Bismillahirrahmanirrahim. BSN third semester Health Assessment Unit number 1 Introduction to Health Assessment. इस पदी चैप्टर के मुसर कमी ऑब्जेक्टिव डी डिफाइन हेल्थ असेसमेंट एंड हेल्थ असेसमेंट एसेंशियल हेल्थ कॉन्सेप्ट अंडरस्टैंड प्रोसेस टाइप्स मेथड्स पर्पस इंपॉर्टेंस हेल्थ असेसमेंट टाइप्स मेथड पर्पस इंपॉर्टेंस ऑफ डाटा कलेक्शन पदी फर्स्ट चैप्टर की मुसर द ऑब्जेक्टिव डी स्टडी करो. What is health? Health satawai, it's a definition there. Health is the state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease or infirmity. WHO recently added the ability to lead a socially, economically productive life. چې څوک ته نه health definition ته پوس وکړي نو ته به څنګه چې complete physically, mentally, socially, and spiritual well-being ته مونږ څه وایو health وایو. What is assessment? The action of assessing someone or something is called assessment. چې ته کله موږ کله یو څه چیک کوو هغې ته assessment ویل کېږي. The act of judging, deciding the amount, value, quality or importance of something دې ته مو assessment وایو. د شي والا مونږ amount ګورو هغې قیمت ګورو هغې والا quality ګورو نو دې ته اسسمنټ وایي. او په مونږ میډیکل کې د پیشنټ والا مونږ اسسمنټ کوو د هغې والا ډیزیز ګورو ابنارملیټي چیک کوو. health assessment the process of collecting validating and clustering data about the health is called health assessment. چې health باره کې کله مو د پیشنټ نه ډیټا کلیکټ کوو هغه والا ابنارملیټي چیک کوو هغه آیز ګورو هغه سکین ګورو هیرز ګورو نیلز ګورو هغه ټمپریچر ګورو بی پی ګورو هارت ریټ ګورو بلډ مختلف سیزونه ویلیوز مونږ نوٹ کوو هغې ته health assessment ویل کېږي. The health assessment is a plan of care that identify the specific needs of a person and how those needs will be addressed by the healthcare system or skilled nursing facility. Health assessment is the evaluation of the health status by performing a physical exam after taking a health history. Nursing assessment satawai collection of subjective and objective data to determine a client or all level of functioning in order to make a professional clinical judgment. Focus on the client as a person and reach to the optimal level of wellness. Holistic approach. Medical assessment satawai focus primarily on the client physiological changes diagnosis and treatment. چې څوک نه تپوس وکړي چې نرسنګ اسسمنټ او میډیکل اسسمنټ کې څه ډیفرنس دی نو میډیکل اسسمنټ چې دی هغه فیزیولوژیکل چینجز ته ګوري هغه به ټریټمنټ ورته کوي ډایګنوز به کوي د ډیزیز والا او نرسنګ اسسمنټ کې به څه شي وي چې هغه والا اور آل لیول اف فنکشنینګ به پکې کتلی شي هغه پروفیشنل کلینیکل ججمنټ دی هغې کې به ته پورا د باډي والا سروې به کوي هغې والا ویلیوز به نوټ کوي ابنارملیټي به چیک کوي پکې. Illness satawai it is an abnormal highly personal and subjective feeling in which individual physical emotional intellectual social developmental or spiritual function is thought to be diminished or impaired. چې ته کله دا سوچ وکړې که نه چې ما والا د سترګه چې دی دا کار نه کوي او هغه لږ ډېر کار کوي بیا هم نو دا ټوله څه شي ده ایلنس ده هغه سبجیکټیو فیلینګ د پیشنټ ځان ته فیل کوي چې زه سیټ نه یم. Disease satawai a disorder of structure or function in the human animal or plant especially one type produce specific symptoms or that of effect specific location and is not simply a direct result of physical injury. Disorder کې موږ سره هغه څه شی وي هغه disorder وي د structure یا د function والا په د هیومن organ یا tissues کې نو هغې ته موږ disease وایو هغه د specific د pathogens د وجې کېږي. What is wellness is generally used to mean a healthy balance of a body and soul that result in our all feeling of well-being. څنګه illness ته چې ځان بیمار ګڼئ او wellness څه شی ده چې ته health balance ګڼئ او هغه ټیک ګڼئ یو خپل complete well-being ګڼئ our all feeling of well-being is called wellness. That is a short definition there. What is a health assessment and nursing process? The nursing process consists of 5 dynamic interrelated phases. First phase is the assessment, second is nursing diagnose, third is planning, fourth is implementation, and fifth is evaluation. This 5 step is very important in every health assessment. Phases of the nursing diagnose ये 5 फेजेस होते हैं असेसमेंट डायग्नोसिस प्लानिंग इम्प्लीमेंटेशन एंड इवैल्यूएशन. असेसमेंट में क्या करते हैं हम सब्जेक्टिव पेशेंट आपको अपने बारे में बताता है और हम पेशेंट के बारे में सवाल करते हैं, पूछते हैं। जो पेशेंट बताता है उसको सब्जेक्टिव डाटा कहते हैं और जो हम चेक करते हैं, फॉर एग्जांपल चेमुकल बीपी चेक कऊ नो द ऑब्जेक्टिव डाटा दा डायग्नोसिस तो यही एनालाइजिंग सब्जेक्टिव एंड ऑब्जेक्टिव डाटा टू मेक अ प्रोफेशनल नर्सिंग जजमेंट nursing diagnose collaborative problem or referral is called diagnosis. What is planning? Determining outcome criteria and developing a plan. Determining outcome criteria उसमें तस्य कवल पकोर दे problem बस संगे सोल को अगे ता planning की आई implementation चीज़ चित्ता carry out के आगा चिकम plan देते हैं उनके आगा apply के patient बांधे evaluation की assessing whether outcome criteria have been met or revising the plan as necessary आगा चिकम plan दे जुड़ कड़े भी आप तो बुरे चागा beneficial हो और कनाओ Importance of assessment in nursing process. So अहमियत तो assessment वाला पर nursing process की no assessment की मुझसे कहो पहला जहाँ मुझसे first step था again tone for the rest of the process the identify patient strength and limitation जहाँ मुझसे the patient वाला जिकम अगदे ची patient टिक ते ओका टिकने देबोरे की मुझे पता रो कई collaborative uncollaborative could or could not care of हम जहाँ ज़ख्पल zone ख्याल सतेशी ओ कनशी सोते perform continuously throughout the nursing process तो दम मुसलसल को पेशेंट मूंगा assess को skills of assessment की छः 3H learning skill भी 3H learning skill कम सब मतलब 3H head hand and heart cognitive head problem solving head मतलब चित्त problem भी आगाता easily solve का वाला शे psychomotor hand भी तोला चिकम strong भी है कि दिमर skill भी तो proper IV line post कवल शे effective interpersonal hurt और कि तो सरा यो effective ethical skills मतलब हमदर्दी patient सरा कवल शे चाहता emotional support वर्क है Purpose of assessment the assessment's purpose is to collect data relevant to the patient health status to identify deviation from normal चित्त पेशेंट हो गरे चागा abnormal होने दे to discover the patient's strength and coping resources का पेशेंट तस स्ट्रेस भी टेंशन भी चित्त अगर तसो के अगर ता coping वो के अगर ता लगवन दे तसली वर्के to identify actual problem or patient के चिकम problem दे अगर तस deficiency दा diet deficiency था नोर सब behavioral changes दी नोगा बतप के diagnose करे to mark factor that place the patient at risk of our health problem. Types of health assessment 5 types the types of health assessment 5 types initial assessment focus assessment time lapse assessment and emergency assessment हाँ नो इनिशियल असेसमेंट कम दे फोकस असेसमेंट कम दे टाइम लैप्स कम दे और इमरजेंसी कम दे Comprehensive assessment is usually initial assessment and include detailed health history and physical examination and examine the client or all health status. For comprehensive की वहाँ मुझसे टोलना मख की जगह सरा physical examination मुझसे की और all body वाला or focus assessment के problem oriented we may be initial assessment are an ongoing. For example, sugar patient ते अगाम चे डॉक्टर तलोट शेज़ो के क़वाल assessment तो शी ओबिया मुसलसल अगावला sugar check की the focused assessment दे. Initial assessment अगर तो वाई चे also the admission assessment is performed when the client enter the चिक्कला patient ward था या OPD ता in the चिक्कम assessment की the initial assessment वाई purpose is to evaluate the client health status to identify functional health pattern that are problematic and to provide an in-depth comprehensive database which is critical for evaluating changes in the client health status in subsequent class assessment. Functional health pattern जी द ज़रूरी दी हर पेशेंट दे पूरा द चिकम 11 points दी दा दे हर पेशेंट दे पूरा ज़रूरी दी दा दे कि यो पॉइंट डिफिशिएंसी वशी नो दा बिया वेलनेस न फील कई पेशेंट फर्स्ट से दे हेल्थ परसेप्शन एंड मैनेजमेंट सेकंड न्यूट्रिशनल मेटाबॉलिक 3 elimination pattern 4 activity exercise 5 sleep and rest 6 cognitive perceptual 7 self perception self concept 8 role relationship 9 sexuality reproductive 8 coping stress tolerance 11 value belief pattern. Problem focused assessment is a type. Now problem focused assessment collect data about the problem that has already been identified. For example किसी पेशेंट का diabetes mellitus डायग्नोज है वो दोबारा असेसमेंट के लिए आता है और नर्स उसको असेस करता है ताकि उसको शुगर चेक करे कि कहीं ज़्यादा तो नहीं है, तो फिर उसके लिए इंसुलिन या टैबलेट्स लेता है पेशेंट. दिस टाइप ऑफ असेसमेंट हैज़ अ narrower scope and a shorter time frame than the initial assessment. In problem focused assessment, nurse determine whether the problem still exists and whether the status of the problem has changed, improved, worsened या resolved. देखिए مو patient ګورو چې هغه ټیک شولو یا نور خراب شوی ده یا هغه والا problem ختم شو. This assessment also include the appraisals of any new ignored and misdiagnosed problems. In intensive care unit, problem focused assessment may be performed every year. چې کوم آی سی یو کې پیشنټ یو کوم مسلسل ګورو هغه ته یا د ریسپیریټری پرابلم وي یا ته دینه علاوه نیورو پرابلم وي هغه مو بار بار چیک کوو هغه پیشنټ. Time-lapse assessment for ongoing assessment. Time-lapse assessment, another type of assessment, take place after the initial assessment to evaluate any changes in the client functional health. Time-lapse تا کوي کنه چې لږ ټایم بعد دوباره هغه پیشنټ چیک کول ضروری وي. Nurse perform time-lapse assessment when substantial periods of times have elapsed between assessment, periodic output, patient clinic visits, home health visit, health and developmental screening. The time-lapse assessment kersi. Emergency assessment take place in life-threatening situation in which the preservation of life is the top priority. फॉर एग्जांपल एक्सीडेंट की कंडीशन में किसी का सांस बंद हो रहा है, ज़्यादा ब्लीडिंग हो रही है, तो इस दौरान हम इमरजेंसी असेसमेंट करते हैं. ऑफन द क्लाइंट डिफिकल्ट इन्वॉल्व एयरवे ब्रीथिंग सर्कुलेटरी प्रॉब्लम ईबीसी चेक करते हैं. सडन चेंजेस इन सेल्फ कॉन्सेप्ट, सुसाइडल थॉट्स, रोल्स और रिलेशनशिप्स, सोशल कॉन्फ्लिक्ट लीडिंग टू वायलेंट एक्ट कैन आल्सो इनिशिएट एन emergency. Emergency assessment focus on a few essential health patterns and is not comprehensive. Importance of nursing health assessment. The health assessment अहमियत था systemic and continuous collection of the client data मुसर दे मरीज वाला data रोशी focus on client response to health problem چې मरीज ته problem दे अगे बंदी मुंग response को. The nurse carefully examine the client body part to determine any abnormality. Nurse the patient वाला چې कम body की abnormality भी अगा find के. The nurse roles on data from different sources which can indicate significant clinical problems. Provide a baseline used to plan the client's care. Help the nurse to diagnose client problems and the intervention. Complete health assessment involve a more detailed review of client condition. Health assessment influence the choice of therapies and client's response. Assessment process. असेसमेंट के मूंगा टोलो न पहला कलेक्ट डाटा को पेशेंट ना सब्जेक्टिव डेटा वखलू और मूंगा ऑब्जेक्टिव डेटा फाइंड को बिया आगा डेटा ऑर्गेनाइज को मतलब पे तरतीब सरे वली को बिया आगा डेटा क्यों गुरु चित्सा गलत डेटा को मने दरखास्त आगा वैलिडेट को चिकल आगा वैलिडेट शी आगे दे बाद अमू जोन सरा डॉक्यूमेंट को दे पेशेंट वाला कम फाइल जी collection of data होगू. Gathering information about the client, physical, psychological, emotion, socio-culture, spiritual factor that may affect client health status. Include post health history of the client, allergy, past surgeries, chronic diseases including current present problem of client, pain, nausea, sleep pattern, religious practice, medication or treatment the client is taking now. نو مونږ چې کله ډیټا راخلو نه هي کې وو پاست میډیکل هیستوري ګورو, فزیکل, سایکولوژیکل, ایموشنل, سوشل, دغه سپیریچوال فیکٹر به ګورو, سرجری خو نه ده شوی, کرونیک ډیزیز خو هغه ته نه ده, سلیپ پیټرن به ګورو, ریلیجیس به ګورو, میډیکیشن خو نه یوز کوي, دغه ټوله ډیټا بو وینا نوٹ کوو. ټایپس اف ډاټا مو سره سره سبجیکټیو ډاټا ده اور ऑब्जेक्टिव डाटा. सब्जेक्टिव डाटा मु सरा सिम्टम्स बतावाई या ता कोवर्ड डेटा या एमसीक्यूज दे दغه पॉइंट रसी. No, subjective هغه چې کوم تاسو ته پیشنټ ښيي. When performing an assessment, the nurse gathers subjective and objective data. Are the verbal statement provided by the patient statement about nausea and descriptions of pain and fatigue are example of subjective data. Objective data هغه دي چې هغه nurse خپل find کوي. هغه ته signs وایي یا over data ته یي. Are detectable by an observer. Each can measure the tested against an accepted standard. They can be seen, heard, felt or smelled, and they are obtained by observation or physical examination. For example, discoloration of the skin अगर discolor the patient ता देर पता न लगी हो nurse ता पता लगी बिया. Data collection method موږ سره کومې طریقې دي موږ په کومه طریقو باندې پیشنټ نه ډیټا اخلو by observation interviewing and examination observation to observe چې کله موږ په خپل سترګو باندې ګورو observe to gather data by using senses interview is a planned communication a conversation with a purpose for example موږ د health باره کې د پیشنټ نه یو ډیټا اخلو هغه موږ سره interview دی examination چې دی performance of the physical examination the physical examination is often guided by data provided by the patient. A head-to-toe approach is frequently used to provide systemic approach that helps to avoid omitting important data. Organizing data, the nurse uses a written or computerized format that organize the assessment data systematically. The format may be modified according to the client physical status. Is called organize of data. Validating data information gathered during the assessment phase must be complete factually and accurate because the nurse diagnosis and intervention are based on this information. Validation is the act of double checking or verifying data to confirm that it is accurate and factual. Purposes of data collection हम क्यों डेटा को वैलिडेट करते हैं डाटा वैलिडेशन टू इंश्योर दैट डाटा कलेक्शन इज कंप्लीट चाहे सर कंप्लीट थे ऑब्जेक्टिव एंड ऑब्जेक्टिव की गलत हो पाकिस्तान नश्तरी या एडिशनल डाटा दैट मे बी या मुता नोट्स शी वाला मालूमात कवल पकोर दी ना या जंपिंग टू कंक्लूजन दागा बनकू और डिफरेंशिएट पकाऊ साइंस एंड interferences. Documentation of data बको approach to documentation वाला two types थी SOMR POMR. SOMR means source oriented medical record, problem oriented medical record. Source oriented medical record source oriented medical record is the keep together by subjective matter labs are all together, progress notes are all together. It is done by department, so each healthcare group has a section to document finding. This is source oriented medical record deta wai. A problem teach everyone involved in the care of the patient chart on the same form. पर ये क्यों form की पूरा department वाला values note कीगी same problem बंदे. This follow for better communication of data to resolve the patient problems collaboratively. प्रॉब्लम ओरिएंटेड के मतलब چې په یو پیج باندې کیږي اور سورس اورینټډ مطلب مختلف پارټس کې د هر ډپارټمنټ ولا مختلف ډاټا نوٹ کړي. میتھڈز اف اس او پی آئی ای پرابلم اورینټډ کې موږ سره two types the problem intervention evaluation PIA or DAR data action response. The methods the diagola pehla problem intervention evaluation data action response. This is the end of first chapter of health assessment. Allah